Good morning, good afternoon, depending where you are. Welcome to the WTO Public Forum 2021 on Trade Beyond COVID-19, Building Resilience. And today's session number 44 is on quality infrastructure for post-COVID-19 resilience in Africa. We'll be having 4 panelists that are in the field of quality infrastructure in different areas. When you look at the quality infrastructure role during the COVID-19, it has been very, very important, starting from the mask that we all wear, and the other PPE material equipment that we had actually to manufacture in a short time period. I would like to present first our first speaker for today, who is Dr. Pauline Wairimo, Assistant Director, Pharmacy and Poison Board in the Republic of Kenya. She's also the chairperson of Africa Medical Device Forum and the expert in pharmaceutical and regulatory issues. Pauline, when you look at the situation of COVID we have been living in and we still live in, and hoping that we're gonna have a post-COVID, we had many issues on our continent, where we had to actually have some homegrown solution and different initiative. How do you see the repositioning of Africa and the challenges looking at the challenges that we had during the COVID? Do you see opportunities of facilitating access to essential medicine goods and support actually the local production? You are from Kenya. We had initiative for developing actually even ventilators. Yeah, how do you see we should move ahead? What are the challenges and the new opportunities?
Thank you very much for your kind introduction. A very good morning, good afternoon, and good evening to all our participants and the attendees. My name is Pauline Wairimo, and I'm the chair of the Africa Medical Device Regulators Forum. And I wanted to begin by sharing just a few statements before I can go on to elaborate and give an opening remark with regard to the questions that have been asked. The Africa Medical Device Regulators Forum is the Continental Technical Working Group for Medical Devices and In Vitro Diagnostic. We are having our secretariat as WHO and AUDA-NEPAD, African Union Development Agency, AUDA-NEPAD. And through that, we are tasked, or we have committed to accelerating and developing tools, documentation, guidelines, or any material that can be used to help alleviate and inform the regulatory framework for medical devices in all African countries. I work at the National Regulatory Authority also in the Republic of Kenya, the Pharmacy and Poisons Board, having my area of interest in medical devices and in vitro diagnostics for the last 11 years now. And through that time, I have seen and helped where I could in the development of the regulatory framework, which included the setting up of the importation, registration, or the vigilance aspects of regulation that enable access to products in a market. I want to sort of give a brief opening with regards to just how the pandemic situation caught us. We had, of course, the pressure of requirements of products that are normally in short supply in Africa, the requirements for personal protective equipment, the need for masks, the need for coveralls, the need for ventilators, gloves, and all the other products that were really essential during this pandemic, including in vitro diagnostics. They are products that are not readily available usually. They require manufacturing, they require supply chain management, and they are products that are sensitive owing to their safety and performance requirements. These products were needed fast, quite quickly. The urgency was that they were needed like yesterday. And truly, when we look at Africa, for example, the over-reliance of importation put us at unique challenges in that we had to rely on importation from foreign markets. And that really created shortages that were difficult to mitigate at the time. There were requirements for high demand or high quality ventilators. We saw car manufacturers that are not necessarily in the field of manufacturing of ventilators, changing course and opting or volunteering to manufacture ventilators. And these brought about unique regulatory challenges. We had donations also that landed from many countries far and wide. And those donations often are not always when we do not have a quality assurance aspect or angle to it. A donation which lands at your airport and it's supposed to go directly to the public does pose its own challenges, as you may see. So the pandemic has brought about unique conditions. However, it has also brought about very, very prime opportunities that I will speak to in a short while, that manufacturers that we have seen our markets adapt. We have seen changes in regulatory landscape and systems. And this, I believe, through the pandemic, we have had valuable lessons that we can share, that we can develop, we can implement, and we can actually accelerate the processes, regulatory processes that are needed and required urgently to ensure that we can become self-sustaining. I thank you.
Thank you very much, Pauline. Actually, you talked about the shortage of high quality product, and actually the issue of the donation that we couldn't on the African continent probably test and follow the normal regulation. I would like to come to our second panelist speaker, who is Barbara from the German Meteorology Institute, PTB, who has been an expert in Africa, looking at the issue of quality infrastructure. Actually, who is currently the head of Sub-Saharan Africa support from the PTB. When you look at the activities that you have done in the regional economical communities and the activities you have done with the Pan-African equality infrastructure, I would like to ask, following what Pauline has just said, what are the lessons, a few lessons learned that's arising from this COVID that Africa should probably learn from, looking at the challenges on over-reliance on import from outside the continent and linking to the quality infrastructure. You had that, we had donation that actually we couldn't even test. We had these issues on the regulation. What is your view? What are the lessons that we can learn from? Thank you.
And hello everyone to well, in Geneva, and yes, of course, there we have already some of the important questions regarding the pandemic and our work. And let me maybe start with a quick perspective on the. Yeah, I can start
Barbara,
with this
can you
one
put
relevant
on
sentence.
The camera, please?
Which is, oh, my camera is connected. I try to unconnect. Can you see me now? The camera is on. I can see my own picture. And can see you, but you can't see me.
Yeah, maybe it's a slow connection on your side. Yeah.
Yes.
Yeah, please go ahead.
I'm so sorry. My video is on. Okay. Yes, I'm sorry. So I will go on. Okay, I mean,
Yes,
I can
please.
start with this one sentence, which is okay, which is quality infrastructure is not everything, but without quality infrastructure, everything is nothing. And this is indeed what is guiding our work, because at a first glance, what we call quality infrastructure is not that visible, and therefore lacks understanding at policy level and at decision-making level, and there is still need for awareness and sanitization. Bad quality infrastructure then becomes visible if it's not respected, e.g., if it leads in food poisoning or collapsing of buildings or goods not being able to be traded, transported, or also health-related goods for sure. So it is quality infrastructure is relevant to reduce unnecessary technical barriers to trade. And we as P2B, we do support, or our support is embedded in the long-term Quality for Africa strategy and taking into account the AU agenda on African economic integration. We do follow a multi-level approach, so at national, regional, and continental level, to ensure that this support is geared towards international good practices. We do work closely with the African Union Commission, with the AFCFTA Secretariat, with PARCI, with the Bank, and other relevant partners at the continental level. We do work with the regional economic communities at the regional level and with quality infrastructure institutions at national level, well, to support harmonization and alignment at all levels. And together we have achieved already a lot. Just for example, a strong interlinking of PARCI and the regional economic communities. And secondly, our partners adopted more than 1,500 harmonized standards at continental level. And third, more than 600 calibration capabilities were internationally reviewed and approved in Africa. So this is quite what we are doing for years and years already. And what changed with the pandemic is the awareness of quality infrastructure, or better, the absence of quality infrastructure. Suddenly, global value chains become visible because they're interrupted. And also the requirements for global value chains become visible. But also the need for quality assurance of products and services produced on the continent became more visible. And we just need to think of the production of vaccines or pharmaceuticals, but that's just an example. And it is the strengthening of the quality infrastructure system on the African continent what is getting even more attention. There is this common statement, because you asked for the lesson learned we have achieved during this pandemic, and there is a common statement that we all hear a lot. It is Africa is the continent of chances. And yes, this is indeed true. And regarding various sectors, it is about pharmaceuticals, but also other sectors, agriculture, textile, and whatever. But quality infrastructure remains a challenge and is still hindering the continent to utilize the full potential. And these sectors have, I'll try to switch on my camera again. We have one thing in common: the quality of projects or services need to be right. And that means it must be proven that projects and services comply with standards and technical regulation. And this conformity must not only be proven, but also to be based on international and mutually recognized procedures. And the COVID-19 pandemic has greatly improved awareness of standards, material testing, accreditation, market surveillance, in fact, all quality infrastructure elements, as I mentioned before. Everyone knows the FFP standards now, and that PCR testing should be done by accredited laboratories. Infrared thermometers must be calibrated, testing of respiratory equipment, and so on and so on. So if I need to name three lessons, it would be first, the COVID-19 pandemic has also highlighted the dependence on global value chains, and not only in vaccine and drug production, but also for countless other projects. Therefore, a stronger focus on regional value chains and production on the continent is needed. And second, the importance of reducing dependence on imports sourced from outside the continent. Anyway, for products from outside the continent or those produced in Africa, the insurance and constant monitoring of the quality of those products is important for people, for the health and also for the environment. And this means that quality infrastructure is one of the tasks of good governance. And third, a functional and above all international recognized quality infrastructure remains a bottleneck in Africa that need to be addressed. But, and this is a positive aspect, with the adoption of the African Quality Policy and other continental quality assurance initiatives, Africa is moving in the right direction already. Yeah, maybe this is it for my first statement of mine. Thank you.
Yeah, thank you, Barbara. Following to what you just said, I would like to go to our next panelist, who is Gailmore Zanamwe, who is a senior manager under the Afrexim Bank, African Export and Import Bank. Is a trade officer under the Intra-Africa Trade Initiative, a senior manager looking at the trade facilitation, industrialization of Africa, actually including the issue on the Africa Continental Free Trade Area. Again, when you look at what just Barbara said, they have been a disruption on the supply chain. And reliance actually on her own words, reliance on global value chain should now change to the focus on the regional value chain. And your bank, the bank is for export and import bank. What are the strategy and the programs that you have to facilitate the quality infrastructure in order now to improve the quality of our product on the continent, actually linking to the regional value chain? Gainmo.
Well, thank you very much, moderator. And I think this is an excellent topic, which is actually at the heart of the things that we do here at the African Export-Import Bank, Afrexim Bank in short. I think it is important to understand the reason why the African Export-Import Bank was actually established. It was primarily to facilitate and promote African trade, which basically includes intra-African trade as well as trade with everybody else, which we call extra-African trade. And the most important thing is that it is really said that intra-African trade is very low, around 15% of total African trade. And if we also look at African trade in terms of global trade, it is also very low, and we have barely exceeded 3% in the past few years. And when we actually looked at some of the challenges affecting intra-African trade, we actually came to the conclusion that quality infrastructure is very important for us to be able to facilitate both intra-African trade and extra-African trade. We actually have been looking at the rate of rejection of products in the continent as well as abroad. But most importantly, the issue of COVID has now actually affirmed some of the analysis that we have actually been doing, that for the continent to be able to increase its share of trade within the continent and globally, we need to focus on manufacturing. We need to focus on industrialization. We need to focus on producing the things that we'll consume, not just focusing on consuming the things that are produced elsewhere. And this basically brings us to the relevant issue that you touched on. We looked at COVID-19 and we saw what it did to the global supply chains. We could not access vaccines. We could not access the PPEs. And if I may put it crudely, we were actually marginalized when we were trying to access vaccines. Even though we had the money to buy vaccines, we were not able to actually buy vaccines. I can tell you that Afreximbank actually had money. We actually put 2 billion on the table to say we are willing to buy vaccines from wherever they are, but we actually struggled. Finally, we entered into a deal with one of the manufacturers, and we are now supporting the continent to actually have access to about 400 million vaccines to support the continent. But I think the key lesson for us is that we really need to do more in terms of manufacturing vaccines, manufacturing medical and pharmaceutical products. And the bank is already working with UNECA, the AU, to actually kickstart that initiative. We have the market, the 1.3 billion market that is created under the AfCFTA, the African Continental Free Trade Agreement. We have the money. Afreximbank is there to back the companies that are willing to enter into this. So what is missing? I think this is basically where we also need to bring in the dimension of the standards. Somebody may say, okay, made in Africa is poor or inferior. When you bring in quality infrastructure, when you bring in the standards, I think we'll be able to assure the market that we can actually produce medical and pharmaceutical products that can be traded within the continent and globally. We can develop regional value chains in terms of medical and pharmaceutical equipment, as well as any other products, to actually increase intra-African trade, to increase our share of global trade. So we believe that quality infrastructure plays a vital role in the industrialization agenda of the continent. We believe that it is very critical in terms of supporting trade under the AfCFTA, and we've been working with the AfCFTA Secretariat to support the implementation of the SPS and TS, which are vital to the industrialization agenda and the development of regional value chains. I can speak more about some of those regional value chains initiatives in the next probably segment, but I just want to applaud PTB, ASO, and the collaboration that we've actually been doing to try and bring the issue of quality infrastructure at the fore. And this, as you rightly highlighted in your document, they are always the invisible architecture, the invisible infrastructure that is normally forgotten, but that is actually critical for industrialization. The bank has also supported the development of the Africa Quality Policy that has just been endorsed by the AU. We worked with ASO, PTB, and AU, and these are the sort of initiatives that we've also been recommending to our sister financial institutions to also enter into this space to facilitate the development of quality infrastructure. The bank is already taking a lead on this. We are developing a number of initiatives and interventions to support quality infrastructure, but I'll probably stop here, moderator, and I hope I'll be able to touch on some of these things later on. Thank you very much.
Thank you very much, Gailmo. I would like to go to our next speaker, panelist, Eric, who is the head of Technical Barrier to Trade Unit in Trade and Environment Division at the World Trade Organization, and a specialist in regulation, standard, and non-tariff barrier. Eric, you heard what Gailmo said. Africa had money and couldn't even buy the vaccine. And they also said the issue of producing what we don't consume, that we should produce what we consume to be able actually to be competitive. And what we consume should also have good quality, as other speakers discuss about that. When you look at this issue of inequality, what WTO has been doing to contribute to this quality infrastructure to ensure open, secure, transparent, and equitable and predictable environment for world trade? Eric.
So thank you very much, moderator, Dr. Hermogen, and it's nice to see you again, even if it's virtually. It's funny that you're the one at the WTO and I'm sitting at home, but hope we will fix that at some point. I think actually very many good points were made by the previous speakers. I think Gaynor pointed very clearly at the fact that we are talking about assurance, about confidence, and how important this is for trade. So I would step back. Your question was about what we are doing, but perhaps for those who are not following directly the concept of quality infrastructure and why this is important for WTO, I would make that point again, that this is really about recognition, about being able to show that products are safe and that they are of good quality. And that gives trust. And that trust you need for trade. Without trust, you have uncertainty and trade fails. So it is one of the most important things for international trade to have that machinery or that system that underpins the trust or the confidence you have in your products at home, and for goods to be able to trade internationally, and that gives competitiveness. But as was said, it's often invisible. It's much easier to say we need to build a bridge, a school or hospital. I'm not saying those are not priorities, but they're more concrete. But of course, you need, for the cement to build that bridge or that road, you need to have trust in the quality, etc. So it's even further down below and not always very visible. And I think this at the WTO perhaps needs more attention. I think it is growing and it's becoming increasingly more apparent. At the TBT committee, which I follow, often the discussions are about compliance with the requirements, but this is actually even more complicated. This is about demonstrating compliance with the requirements and again, having trust in that. And actually, many of the trade concerns that come to the TBT committee are now increasingly about this, what we would call the conformity assessment part. And it's particularly difficult, I think, for SMEs or MSMEs, because the cost for them to be able to certify, to show, can be quite an obstacle. Larger companies will be able to do this. That's why I do believe that government has a role in this area and an important role to build this infrastructure. It's if you wish, a kind of a public good that I think can be more invested in. So I'm happy to hear also that there is money for that. I would just end by saying that on this question you had in terms of what we do, of course, the TBT agreement has been there since 1995. It doesn't have the concept of quality infrastructure in it. This came afterwards, but the disciplines promote this. Gaynor also mentioned standards, the importance of standards. So the use of international standards is very strongly promoted by the agreement. The agreement also promotes cooperation engagement. And that I see is now happening at the intra-African level, and you may want to come back to this later. And there are even current discussions now where we are looking more closely at quality infrastructure. So I'll leave it at that to begin with. Thank you.
Oh, thank you very much, Eric. Actually, mentioning the compliance issue, when you look at even on the conformity assessment, that's making me to go back to Pauline. Pauline, when you look at, when we are discussing this COVID-19, especially on pharmaceutical issues, Eric mentioned the SMEs are struggling, MSMEs are struggling, and we know on the side of Africa and probably elsewhere, but concentrating on Africa, we have the Africa traditional medicine. Actually, during the time of COVID, you had from the south to east, west, and north, so many countries were producing the medicine, actually even claiming that they cured the COVID. What your view on how can we go on mainstreaming the Africa traditional medicine in the health sector on our continent?
Thank you once again, Dr. Hermogen, for really being to the point. And I want to borrow and continue on the discussion that I began at the opening of this statement. And I want to actually highlight some of the available opportunities that cut across herbal medicine, as well as pharmaceuticals and medical technologies. And I actually want to perhaps also in there communicate a little bit more on medical technologies, specifically the use of medical devices and in vitro diagnostics. And what some of the regulatory ways that products are getting into the market is through what we've just had, reliance and recognition. And this is where we are able to understand and look at a decision that has been made by another regulatory authority, often from a mature nation or a mature regulatory agency. And the decision that is made there, we can use it as a decision to help in bringing to the market through market authorization of that product in the market. And this has traditionally been utilized for pharmaceuticals, but we have seen it also utilized for diagnostics. The COVID-19 diagnostics were essential in ensuring that there was confirmation of the COVID-19 infection, and also in testing, just to ensure that even now the testing aspect is still continuing. So we're looking at leveraging of regulatory work by other entities. That one enables that there is sharing of expertise and information that has already been submitted, been published, and it is useful information. And what that does is in turn it helps to shorten the regulatory time that it takes for products to gain market entry. Traditionally, a product that would go full evaluation, for example, can take from 24 months to 36 months, but we have seen that turn around to a period of just about 3 months now. And that essentially not only saves on the resources, the financial resources, technical expertise, but also we have been able to build on the trust that we've had from WTO as an essential tool for us to be able to harness trade and to ensure that this communicates. The other thing that has really taken root is regulatory flexibilities. And what I mean by regulatory flexibilities is agencies seeing the need to avail products into a market at a much faster rate. And what happened was the use of conditional approval. A conditional approval is one that did not perhaps have all the requirements traditionally asked, and the conditional requirements and requests that were requested granted that a product could get into the market at a much faster rate. And this has helped accelerate importation, market approval, market access, and the availability of that commodity. The other thing is the use of a tool called the emergency use authorization, also which quite closely looks and is interlinked to the regulatory flexibility. It's something that we have seen widely become popular through the pandemic as a tool to be able to ensure that we have faster market access and faster market authorization procedures and processes. And as you ask from herbal medicine, naturopathic products are very, very important. We recognize their role. We had natural herbal products that people were using, and they really worked well during this pandemic to show how the use of complementary medicine can be useful along with the treatment that is required for COVID-19 to be able to help ensure that the person or the patient was getting the comfort, was getting the hydration, was getting product other than the the normal pharmaceutical products that they are usually given. So this has transformed the landscape with regards to accessibility, availability. Traditional medicines tend to be readily available in our markets. Therefore, we don't need to think of importation. We don't need to think of getting them or supply chain issues or needing to get them from farm markets. Often, some of these products are locally available. Therefore, accessibility is faster. It is quick. It's a natural product that people have confidence in using. It's a natural product that people have access to, and therefore as national regulatory agencies, we responded by ensuring and facilitating the access, the availability, the consultation, and really informing of the safety thereof of these products. A thing that I have also seen work tremendously well is the use of collaboration. The collaboration between establishments, for example, the National Regulatory Authority, relying on a research institute, for example, as a way of accelerating and helping to tackle the the need for quality assurance. So, for example, the Research Institute in Kenya, Kenya Medical Research Institute, does have an arm of testing quality aspects of traditional medicine and also in vitro diagnostics for purposes of performance, evaluation, and validation. And we found this to be especially useful because it helps to give the public the information, and for us as regulator, we are also able to know and to be confident in approving a product in a much shorter period. It has met certain aspects of regulation or performance and validation that are really, really critical a tool in ensuring that we still have products that meet the performance and quality that is required.
Thank you very much, Pauline. Yeah.
Thank you.
You really mentioned the shortening of regulatory practice for products to be on the market in a short time, and the tools that you have. I like the need of a condition approval or emergency authorization. Looking at that, I would like to go to ask Barbara. You mentioned the quality policy issues, the same as again more. When you look at now what Pauline said, shortening the process in a way, looking at the emergency issue, but probably should not just look at the emergency cases, but see how our system can respond to the need of our people. What do you see, in your opinion, that's need to be done in terms of quality infrastructure policy frameworks?
Yes, I do switch off my camera now, and I hope you can clearly hear me now. I'm very sorry for these technical problems. Obviously, the German internet system cannot cope with the rain outside, so I'm sorry for that.
We will take you to Africa. Yeah.
Yeah, please. Please. Yes, thank you for that question, Hermogen. Pauline mentioned already so many points I had in my mind, focusing more on the health sector, of course. Anyway, it's not just the pandemic that made chance. I mean, a pandemic can happen again, and it will happen again. We all are aware of that, I think. And it could be also something else that is going to interrupt us or interrupting our global value chain. It could be an environmental catastrophe or anything like that. So we cannot prevent something like this, but we can counter this. I mean, anyway, it has consequences for the national, regional, and international trade. And also without these pandemics or catastrophes or whatever, it is important, I believe, that, as you already mentioned, Africa can care for itself, if I may say that like that. So to ensure that the quality system is working on the continent, that now the word is slipping out of our mind. Anyway, we would need the quality infrastructure for Africa to work. And we do support this as well. And this is why we're working with our partners, with the AUC, with PARCI, with ASO regarding to standards, with Afrexim Bank. Gamer just mentioned the implementation of the African quality policy. But it's also supporting the setting up of an African continental technical regulatory cooperation to support a harmonized African trading system as a way to reduce dependencies from outside the continent, if we have a pandemic or also without a pandemic. And maybe last but not least, in the framework of our project with the AUC, we support local manufacturing of vaccines and medicines and the strengthening of a regulatory framework needed to assure the quality of these pharmaceutical products. And this is not just needed for a pharmaceutical project or the health sector. This is, of course, relevant for many other projects, not just for the health sector, also for, just maybe the agriculture sector, for example. Yes.
Oh, thank you, Barbara. It's not just the health sector, as you said. we need to be ready for the future. Again, this makes me think now on the Africa Continental Free Trade Area. You as the senior manager on the trade in the Africa Bank, Export and Import Bank, you have been dealing with the issue of trade under the African Continental Free Trade Area. What are your thoughts? Do you see the AFCFTA agreement having policy instrument that can make this happen, resilience of the African continent?
Yes, thank you very much, Dr. Emojin. I think this is a very important question. And I think what I can say is that the AFCFTA agreement is now given us the legal framework for addressing issues relating to quality infrastructure, sanitary and phytosanitary measures, technical barriers to trade. And now if you add what we've just talked about, the Africa Quality Policy that has just been endorsed by AU Ministers of Trade, from a policy perspective, we now have the requisite instruments and complement that with some of the existing quality infrastructure institutions under PACI, the Pan-African Quality Infrastructure. I think we have the policy instruments. We now need to do more in terms of actually implementing. I think more needs to be done in terms of testing those instruments to ensure that they actually work to facilitate trade. If you look at a number of studies that have been done under the AFCFTA, yes, there will be gains that will come from reducing tariffs. But the biggest challenge that we face in the continent is in the area of non-tariff barriers and the issues to do with standards, technical regulations, technical barriers. These are some of the key issues that we actually need to deal with. So we actually need to ensure that the policy instruments that we have under the AFCFTA, they are fully implemented to actually facilitate trade. And the role of the institutions like ASO, maybe working with Afrexim Bank, PTB, and others need to now step in to ensure that the continent has got robust policies that are not just on paper, but that are actually implemented. And just to give you a sense of some of the things that the bank is doing to facilitate the implementation and the development of quality infrastructure, which will support the implementation of some of these policy instruments. One key issue that I want to highlight is the work we are doing in terms of the development of what we call the Africa Quality Assurance Centers. These are basically testing, certification, and inspection centers that we are developing. We are starting with Nigeria in Ogun State. So the completion of one center that will be doing testing, certification, inspection, and even training will be completed before the end of this year. And that center will actually support all the key manufacturers and traders in Nigeria to be able to actually produce and export goods that comply with not only the AFCFTA policy instruments, but also with the global requirements, even under the WTO, TBT, and SPS agreement. And when we actually started that initiative, our main focus is to listen to private sector. Before we started this initiative, we actually looked at the challenges that were being faced by an exporter of Nigerian ethnic foods to the US. And these products were being rejected because there were no testing facilities. So we actually decided to intervene to facilitate the development of these Africa Quality Assurance Centers. We are starting in Nigeria, but another one will be in Egypt, Ethiopia, Tanzania. So we believe that there is actually scope to develop these centers that will also facilitate trading under the AFCFTA and globally in compliance with the WTO requirements. We are also working on harmonization of standards. And I think I've heard about challenges in terms of bridges collapsing, houses collapsing, even vehicles. You have a vehicle involved in an accident and it looks like it's plastic. So we know that we need to do more in terms of standards and technical regulations. And we've already started work on harmonization of standards, of course, working with ASO, PTB. We've harmonized the standards in the automotive sector, where we know there are issues to do with pollution, there are issues to do with accidents, safety is important, but most importantly, the industrialization agenda. For us to be able to catalyze the development of a viable automotive industry within the continent, we believe that standards are actually at the heart of the development of an automotive sector. If you take the concept of homologation, you actually need to ensure that you apply standards to the development of the automotive industry. So that's why we've actually intervened in the area of harmonization of the standards in the automotive sector. So far, about 43 standards have been harmonized, and we will continue working with our partners to ensure that the journey is completed. We also, as probably you are aware, we harmonized standards in the medical and pharmaceutical sector. More than 121 standards have already been harmonized to facilitate the production of the PPEs and other medical equipment. This is to deal with the COVID-related issues. So these are practical instruments that will also ensure that we facilitate the implementation of the various SPS, TPD requirements under the AFCFTA agreement and under the WTO agreement as well. So we believe that the policy instruments are there, but it is now a focus more on implementation and putting the practical tools and initiative to support that. I just want to conclude, moderator, by highlighting that in Africa, we don't have much choice, because unlike other developed countries that are able to probably put big stimulus packages, our only panacea is the implementation of the AFCFTA. And we actually need to ensure that the implementation of that agreement is underpinned by robust quality infrastructure, and Afreximbank is basically there to work with the relevant partners to ensure that the continent has the requisite quality infrastructure. We believe that we don't need to beg or to wait for donation or grants. If grants and donations come, they are fine and good, but we are now taking these issues into our own hands, because we believe that this is our continent. The bank was actually created by the member states and the private sector to facilitate trade. So we are calling upon like-minded people to work with us in this journey to facilitate the development of quality infrastructure, to facilitate intra-African trade and industrialization. Merci beaucoup.
Thank you. Thank you. Thank you very much, Gainmo. Eric, you had that Africa has no choice, only the AFCFTA. And you also had the work that is being undertaken, automotive industry, pharmaceutical, and so on. Touching on actually the challenge that you had with all the members of WTO, I guess you had so many challenges during this COVID-19 under the TBT issues. But what can you say about the AFCFTA, also touching, linking to what you had as challenges during this period under the TBT area? Eric.
Thank you. So I think you mentioned two things. One is the AFCFTA and also the challenges related to COVID. But maybe I'll start with the first one, and because I think it's closely related to what Genmore was saying. And it's interesting what you said, Genmore. I think you refer to the AFCFTA, and of course, the Annex 6 of that agreement, it very much builds on, or for the TBT part at least, there's also the SPS annex, but it builds very much on and reaffirms the rights and obligations that exist in the existing TBT agreement, which dates back to 95 and is the one valid today, of course. But of course, the world has moved on. There are many recommendations and things that the committee itself has developed. So it's interesting the annex goes beyond, and that's what makes it, I think, effective, because it even brings up, for instance, the usefulness of EPing, a tool that came much later in terms of getting private sector and everyone aware of upcoming regulations in this area. So I think the importance is very much in that aspect, that this agreement between African countries is going to promote a deeper cooperation, which will be good for the intra-African trade, which was also mentioned that is quite low. I think you mentioned a percentage of around 15%. I think on the practical side and the implementation side, this is very important, because it should help you also establish the different roles for the various institutions that are involved, this deeper cooperation. You mentioned already many, the Africa Quality Policy, you talked about, the Pan-African Quality Infrastructure. You say that the AU now has this mandate to look at the quality policy broadly in Africa. There's the role of ARSO. All this coordination is going to be an implementation challenge, I think. So it's going to be good that it is under one hat. And I think one also needs to look at it from a broader perspective than just QI. Of course, QI is essential, and that's what this is about. But countries often have a regulatory framework in place, and it's important that you are coordinating also with the ministries for trade or the ministries for health or agriculture. How do you bring them on board with respect to decisions that are taken on regulation, and where you need the backing of the quality infrastructure? At the WTO, very briefly, I know time is running short, but at the WTO, I think we're going to see more emphasis on this type of coordination. I think also, while coordination within the African region is important, it is also important that the African region is represented in the international fora. Of course, I would say that coming from the WTO, but I'm not only mean the WTO, I would mean other international standard setting bodies, the ISO, for instance. So a regional cooperation can strengthen your role within international fora, where I think then your voice will be better heard. From the TBT Secretariat point of view at the WTO, we are very ready to help or to provide assistance in this area, both with respect to the basic rules, what the committee does, how this relates to quality infrastructure, and hopefully we'll sooner rather than later we'll be able to travel. I know you mentioned COVID. I can say something about that, but I'll leave it for the moment, and I'll leave that with you, moderator.
Thank you very much, Eric. Actually, thank you very much. And there are so many questions we had that I only have 3 minutes to wrap up. I would like to go to a few questions. One question, Pauline, if you can take it from our participant. What, in your view, are the challenges and the needs when it comes to use digital and IT tools to strengthen the delivery, performance, and processes of the conformity assessment system and the accreditation system in Africa? What, in your view, are the challenges?
Thank you. I think one major challenge that has been across during this time is the need for new innovation products that require use, that require testing, that require our ability, basically, and the staffing to be able to do it. So workforce is one, and staffing is one aspect that is a challenge to get. Homegrown solutions that can actually address the need or the very request that is being met. Another challenge, especially with digital, is connectivity. While some countries in Africa have very good connectivity, for example, the East African region, not all the countries have connectivity that can reach to the rural areas or areas where we want access available. So connectivity can be a challenge to some areas, and that can of course hinder the use of our digitalization and software programs for access. In this pandemic or during this time, however, we have also seen in the turnaround of digital use in through e-telemedicine, and that has also been a useful tool that has grown through the pandemic, and we see it being a trend that is going to grow even stronger post the pandemic period. I don't know whether that answers your question, Dr. Hermogen.
Thank you, Pauline. Thank you very much. And I would like to give this to Barbara. Barbara, you have been working at the REX level. I want to combine two questions. Yeah. At the REX level and at the continental level, together with the Pan-African Equality Infrastructure, they are a little bit similar, but one is what is for you the role of the AFCFTA quality infrastructure and the digital standard with regard to enabling digital services in Africa, and what can actually quality infrastructure do for Africa? That's probably you link also to the role of the regional economical communities in implementing the quality infrastructure.
Yes, I would think so. Generally, the AFCFTA or the AUC or the AU level is setting the framework. So it's setting the framework, and it's the connection to the world. I mean, it is still important for Africa, as for every other continent, to harmonize its quality infrastructure and bring it in line with the international or the global system, to say it better. On the other hand, and now we're coming to the role for the regional economic communities. The regional economic communities are kind of an intermediate step between the AU level and the member states or the countries on the continent. So the AU is giving the framework for the quality infrastructure system and ensures that the standard processes and so on are harmonized and at least at a continental level. And the regional economic communities can then transform this for the needs of their member states, or to give the information to the country state, to the member states, and so on. So I think each and every country on the continent cannot go its own way. There needs to be a way for Africa, and that's the role for the REX, to have this linkage between the countries and the continental level. And that, of course, also not only relates to the quality infrastructure system that will be the same for any kind of a digital transformation, and also the quality infrastructure behind this transformation. I hope this answers the question.
Oh, thank you very much, Barbara. I think you answered the question, actually, all of you, and we only have 2 minutes. Yeah, we cannot go beyond these 2 minutes. I would like to take this opportunity to thank you for your participation, accepting our invitation, all the speakers. Pauline, thank you for participating. Barbara, thank you very much. Gainmore, thank you. Eric, thank you for your contribution to this discussion. I would say in one word that the ball is in our court as Africa, that in also your own words as panelists, that we need to also now relook at the regional value chain and being supported by the quality infrastructure. I thank you very much. I thank WTO who accepted to host this segment of the public forum on the quality infrastructure post-COVID issues. Thank you very much. Thank you, participant. Bye.